Hello and welcome back. Ovarian cancer, fifth leading cause of cancer deaths, about 23,000 diagnoses, 14,000 deaths. Sometimes shows up with enlarged abdomen. Family history of ovarian cancer is a risk factor. Again, prevention is best managed through a diet high in fruits and vegetables, low in fats, including healthy levels of exercise, sleep, reducing stress, and controlling weight. Cervical and endometrial cancer. There are about 13,000 cases of cervical cancer in the United States. If you have not been vaccinated for papillomavirus, a pap smear test is one of the ways that is used to diagnose cervical cancer. Having the HPV virus is a risk factor for cervical cancer. That's why getting vaccinated with the HPV vaccine is particularly effective to reduce dramatically or eliminate your risk of this particular type of cancer. Leukemias are cancers of the blood. Typical leukemias occur in white blood cells, B cells, and T cells. They can be treated with chemotherapy, radiation therapy, occasionally stem cell transplants. Treatments are very effective nowadays for most forms of leukemia. Lymphoma is a different kind of white blood cell cancer. Around 80,000 cases in 2018. Weakened immune system can contribute to development of lymphomas. Chemotherapy, radiotherapies are used, and these cancers are also very treatable for the most part. Pancreatic cancer is a very deadly, rather rare, but really deadly form of cancer. Has particularly high rates in African Americans and people in lower socioeconomic status. But it does occur in all walks of life. This shows pancreas with these white tumors growing throughout. Unfortunately, it is very difficult to diagnose pancreatic cancer and typically shows up very late when the cancer has moved beyond the pancreas and invaded other organs. Because of a fast-growing cancer that invades other organs, it is extremely difficult to treat. Cancer is typically diagnosed using a number of different methods. Some of the most effective methods are magnetic resonance imaging. MRI imaging involves radio signals to look at the structures inside of your body and look to see if there are structures, growths that should not be present. CAT scans uses X-rays, slices through the bodies and a place put together to create a picture of your entire body. Again, looking for abnormal growths using X-rays. CAT scans can be a lifetime risk for cancer, so again, try to keep CAT scans throughout your life to a minimum. Ultrasound uses sound to look for altered structures in internal organs. Now, ultrasound is perfectly safe. And regular self-exams looking for lumps and bumps and things that are not where they should be. That's an important part of cancer diagnosis. Breast cancer or breast cancer screening, mammograms are important. The National Cancer Institute recommends that women ages 45 and up get screened every 1 to 2 years. Recommendations here are fluid. If your risk factors are extremely low, you don't have family history, then that can be pushed out to about age 50. Cervical pap smear, if you have not had the human papillomavirus vaccination, it's important to get regular pap smears to check for cervical cancer. Colon and colorectal cancer, people at risk should start screening at age 45. Others should start screening at 50 plus. It is really important to get checked immediately if you see signs like blood in the feces, and typically that'll involve colonoscopy to check to see if polyps or cancers are forming. Prostate cancer can be tested using a PSA antigen test, which is a blood test. Any men that are suffering from who have prostate cancer in the family should get checked regularly with PSA screening. Cancer treatment, the most effective cancer treatment of all is always surgery. Sometimes there is a thing called stereotactic radiosurgery, where X-rays or gamma rays are directed towards the site of a cancer, effectively destroying just the cells and the site of the cancer. There are radiotherapies which can involve larger parts of the body, chemotherapy which involves chemicals which kill tumor cells, and immunotherapies, which are the latest forms of biological treatment which take the brakes off the immune system and allow the immune system to attack the cancer cells. Our immune system does attack cancer cells, but there are particular brakes in our immune system that prevents that attack going too wild because of the risk to damage throughout the rest of the body. But if a cancer is killing you, that risk is tolerable, considered to be tolerable. So there are drugs that can remove or reduce the effects of those brakes and allow the immune system to effectively attack cancer cells. They're usually used in combination with radio and chemotherapies and can be very effective. Yeah, here we're talking about these new cancer therapies. There are immunotherapies, sometimes targeted immunotherapies, where antibodies with or without chemotherapeutic agents can attack cancer cells. Biological therapies, like we were talking about, where the immune system is allowed to attack the tumor cells. Gene therapies, very new, very interesting. Likely to see a lot more of these in the coming years, where gene therapies are used to create immune system cells that can attack your cancer specifically. There are inhibitors of blood vessel formation, which can lower the risk of metastases. There are some smart drugs which are specific for particular cancers. Those can include things like enzyme inhibitors or cell cycle inhibitors that are specific for a particular type of cancer. And then there's some new stem cell research that's going on, which are interesting, but novel therapies that are under development. Cancer survivors, more and more people are surviving from cancer all the time. When somebody survives a disease as dramatic and drastic as cancer, it creates a lot of physical, psychological, and emotional stress, oftentimes also economic stress. So cancer survivors, need our support to move on and integrate back into a normal life.